Hi, I'm Jenny Guthrie, and I'm an advanced registered nurse practitioner working with Dr. James Webb and Associates at the Osteoporosis Institute. The types of patients that I see with hormonal imbalance are quite diverse. I see younger women with PMS-type symptoms. I also have women that are in midlife that haven't quite made it to menopause, that are perimenopausal, and then women that have passed through that transition in life, even from their mid to late 30s all the way up to the 80s. I also see men, even starting in their mid to late 30s, who are suffering from symptoms of low testosterone. Also in both men and women, I treat a large variety of thyroid issues that also can contribute to other hormonal imbalances. I'm often asked, what is bioidentical hormone replacement therapy? It refers to the type of hormones given, but in my mind it also is related to the philosophy and the type of care delivered with the hormones. Bioidentical refers to hormones that are chemically structured like what our body makes versus something that's made in a lab or comes from an animal that is not chemically structured like what the human body makes. It also, in the style of practice that I have, refers to giving people hormones in a balance versus just giving them one hormone type that's trying to treat a multitude of symptoms that it may not be capable of doing. Looking at a variety of different hormones such as estrogen, testosterone, DHEA, and the thyroid, we're able to combine a specific type or prescription of hormones for each individual patient based on their symptoms and their medical history. Because of the media and different forums where hormone replacement therapy is being discussed more openly, I find that men are more comfortable in coming and talking with me about their symptoms, and I'm actually grateful for that. The thing that men can experience is this kind of slow slide into what I call couch potatohood, where they just kind of are apathetic, they come home in the evening and they have no energy to do anything. And it happens very gradually and subtly in most men, and they don't even realize it's happening. And what happens is you just have less zest for life. Your hobbies and things don't interest you as much, or you don't have the energy or the capacity to be able to do them and enjoy them. And then losing muscle tone. When you do exercise, you find that the exercise is not effective. You don't have the energy to complete the workout in a good way, or you're so tired when you're done that you wish you hadn't gone to the gym. The other thing is just poor muscle tone. And a big thing that men it's not often addressed with men, is bone loss and osteoporosis. That's classically thought of as a woman's disease, but really men suffer from osteoporosis as well, and we find that that's namely related to low testosterone for decades that's been completely ignored and untreated. And then classically, men that have sexual dysfunction, we think of low testosterone levels with them. And I can't tell you how many men that I've talked with that have been given medications like Viagra or Cialis, and they say they just don't work and they're very frustrated by that. Well, if you don't have a high enough circulating testosterone level, then medicines like Viagra and Cialis aren't going to work. So sometimes you have to get the cart behind the horse so that way you can have proper treatment and proper resolution of symptoms. I have a lot of my ladies that come and talk with me about their menopausal symptoms that are also suffering from anxiety and depression. Now, while those are true standalone conditions that you can have and that do need appropriate treatment, sometimes hormonal imbalances can exacerbate those things and actually make them worse. The unfortunate reality is also that many of my patients have been seeking treatment for hormonal imbalance and been given only one hormone when we know it's a symphony of hormones that are contributing to their symptoms. So they come to me on one hormone and they're still having flares of these other symptoms that are being inappropriately or inadequately treated. And a lot of times they'll come to me already on an antidepressant or some type of anti-anxiety medicine, which they may or may not in reality need. In both men and women with hormonal imbalances, they can suffer some of the same symptoms. Things like difficulty to lose weight, or the middle section spread, that tire that we get as we get older in life that it's difficult to lose despite trying many different exercise programs or different dietary restrictions or different nutrition plans. You can still be extremely frustrated that you're not able to lose that weight. I always tell my patients that the hormones are like aligning the stars and getting your metabolism primed and ready to be able to lose weight and be able to maintain a healthy body composition. It's not going to make the weight just fall off of you, but as you do your due diligence, it's going to help those things actually work, and you'll have less frustration as you're working toward those things. The other thing is joint pain. There have been studies that have shown that individuals that have osteoarthritis, and most of us develop that as we get older in life, we find that with hormonal imbalances, many people suffer increased pain from the osteoarthritis, and as you level out the hormones, sometimes those pain levels will come down in response to having proper hormone balance. I have so many patients come to me that blame their symptoms purely on thyroid imbalance, yet they've gone to see their regular primary care physician or another care provider, and their thyroid's been checked and they're told that it's normal. And that very well could be the case, that it's not their thyroid, but it's some other hormonal imbalance. But in looking really at the thyroid, what we want to look at is your free T3 level, which is the active thyroid hormone that's available to work. That's very important, because if that is low and you have what we call a secondary or a subclinical, which I know that sounds really big, but subclinical hypothyroidism, then as I start replacing your hormones like estrogen and testosterone and DHEA, that thyroid is very important in letting your body uptake and use the hormones that are being replaced. So again, the philosophy of having a proper balance and looking at the symphony of the hormones is vital. One thing is with stress levels, which we all suffer with a lot of stress in our society these days, and there's probably no end in sight to the stress that we're subjected to. But what we can change is sometimes how we respond to those stresses and how we deal with them and cope with them in our lives. Well, if your stress level is really high, your cortisol level is going to be really high. And if your cortisol level is really high, it's going to inactivate your thyroid hormones. And if your thyroid hormones are inactivated, then the other hormones, namely estrogen and testosterone, are not going to be absorbed and utilized properly even when they're given to you. So again, you can see how the symphony of hormones is very important, that we look at all of them and treat them all together at the same time to create the best result for you. Some of my patients encounter quite a few barriers in trying to receive proper hormone replacement therapy. There's a lot of fear in the medical world over hormone replacement therapy. A lot of this is due to a study that came out called the Women's Health Initiative. Well, we do need to have a healthy respect for hormone replacement therapy and take into consideration one's past medical history and current lifestyle. We also need to not have inappropriate fear over hormones. Some of the studies that were done on synthetic hormones, or also hormones that were given without a proper balance. One of the current philosophies is that it is the lowest dose for the shortest amount of time. While I can understand why that philosophy is present in the medical world, I don't believe that there's truly medical data to back it up. I think that giving hormones in a true symphony is actually better, safer, and promotes a better quality of life for our patients. The problem with synthetic hormones is that they exert some of the effects of the hormones that are excreted in our bodies naturally, but not all of them. They bind with the cell receptor sites. It's the parking space of the cell. And they bind there and they exert some of the effects, which is how they get approval for use. But on the flip side, there are metabolites or byproducts of them that sometimes we can't track in the body, or that we know don't exert all of the good effects in other parts of the body. And so it's an incomplete way to replace your hormones.
Very sweet.
It does my heart good to have my patients come back and follow up with me and just let me know how well they're feeling, how much better they're able to live their lives, and they feel like their old selves again. That's what rewards me day in and day out, and why I show up to work every day. Please come see me for your hormone evaluation. I don't believe there's any need for you to suffer the litany of symptoms that come from hormonal imbalance, namely hot flashes and night sweats, mood swings, being up and down, poor memory, fatigue. You just can't get going every day. You don't feel like your normal self, or you always feel like there's something off and you can't really put your finger on why. You have low sex drive, less interest in intimacy, men with erectile dysfunction, again, bone loss and osteoporosis, which are strongly linked to hormonal imbalances. There is absolutely no reason for you to suffer from these symptoms. Come see me and see what relief we can offer you.